we didn't necessarily envision a detox center and a residential center and a mental health center. And all right, if we had a clean slate, which we kind of did, we didn't have anybody else telling us what to do or what to, how to build the program or whatever. How would we build it, in the way that we would have wanted to go through it, or in a way where we would have wanted to work for us, or, that type of thinking. And so we pulled from a lot of experiences, positive and negative. You end up taking more of the good, and I feel like that's what we were able to do.
Welcome back, everybody, to Finding Mental Wellness. I'm very excited for today's episode as we get to talk about all of the growth and evolution that has happened here at Midwest Recovery Centers. What once started as just a PHP program, which is outpatient with housing, and how it's turned into a full continuum of care for those needing mental health or substance use disorder treatment. Because Midwest has evolved and changed so much, we thought that what better way to learn about that change and how it's continuing to progress each day than to talk to one of its founders and current owners, Geffen Liberman, our Vice President of Operations. We're going to hear from Geffen, sharing more about what he and the other owners felt as an inspiration to start Midwest Recovery Centers and how they navigated all of the challenges along the way to recognize what patient needs were and how to adapt and evolve the business in order to give our patients what it is that they need. We're really excited for you to listen or watch this episode of Finding Mental Wellness. All right, everybody, welcome back to Finding Mental Wellness. I am your host, Taylor Brown, and today we have the pleasure of speaking with one of the founders of Midwest Recovery Centers, Geffen Liberman. Geffen, thanks for
Taylor.
joining us today. We really appreciate your time. We know that you're busy, so thank you very much for joining us.
I appreciate it. Excited.
I think it'll be interesting for people to watch and listen to myself interviewing somebody who created this entire program, right? And not only just that, but has been in the behavioral health field for over 30 years, right? I think like 35 years,
Pretty close.
36 maybe?
Somewhere in the high 20s, I think.
Oh, high 20s. Okay. So I shot a little high there, but and you have personal experience as well, which our viewers and listeners are going to learn. So I think there is a lot to be said for somebody that's going through mental health crisis or substance abuse, substance use disorder and different struggles with addiction. So I just want to paint a picture for our listeners and viewers to understand that I wouldn't be here today, right? For more reasons than just my personal recovery. But everybody that works at Midwest Recovery Centers wouldn't be here without you and the other two owners, of course. But you took a leap of faith when running your own practice to decide to create Midwest Recovery Centers and everything that it is today. So just a little nod and a thank you for everything that you did and the sacrifices you had to make this this dream possible, because it's had a profound impact on myself and my family and many people that I know. So we thank you for going out on a limb there.
Yeah, you're very welcome. I will tell you that we see it almost the opposite, right? We see it as, well, we wouldn't be where we're at, personally, spiritually, mentally, emotionally, from a business perspective, however you want to see it, without, you guys, and without the employees that have worked really hard over the years, and without the families that have trusted us with their loved ones. And so I think it really has been a team effort. I know it sounds a little cliche, but I think it's true, and kind of a God thing, if you will. And, and we're just here to try to keep that rolling as long as we can.
Absolutely. And just one other question before we dive into your background and all the different topics we'll touch on today. Did you think when it started it was going to become what it is today?
People ask me that a lot. No, I don't think that we did. Or maybe if we had sat down and like really kind of visualized it, if you will, or mapped it out, maybe we would have landed there. But I don't think so. I don't know what we envisioned exactly, other than just providing a really cool, clinical term there, like a really cool program for people to be able to tackle some of the issues you talked about, like mental health and substance use disorder and things of that nature. And we figured it would be effective because we believed in ourselves and we believed in our experience. And we believed and knew that this area needed a program like Midwest Recovery Centers. But I don't think we could have ever possibly envisioned it, going from like basically a couple of us, and I didn't even live here at the time when it started, and to now, having well over 100 employees and multiple centers and everything that it's turned into.
Okay, so Geffen, if I may, will you tell us a little bit about your background story and what happened with you in your youth that led you to finding recovery?
Yeah, sure. So, I think like a lot of people in our space, not everybody, and it's not like, you have to have the prerequisite, but I did have the prerequisite of let's just say making some real poor choices when I was younger and landing myself into a lot of trouble in the drug and alcohol world. And, thankfully, when I was about 17, somewhere in between 17 and 18, my parents found a really positive program for somebody in my age, like a real tailored program for adolescents that they got me into in Phoenix. I lived in Texas at the time, but they had arranged for me to go out to this program in Arizona, and that was a real life changer for me, right? So I went through treatment out there, and this would have been God summer of '94. And met some people that I'm still close with to this day, and I really went through a personal transformation over that couple of year period that kind of makes up early recovery, and really bought into the thing that stuck out to me the most was the helping others part of it. And I knew, I had some really great mentors and peers and just, friends that went through treatment with me that I looked up to that really mentored me and helped me and, just stayed up late talking to me at night and things of that nature. And I really developed a passion for paying that back, if you will, and giving that back. And as you know, and as anybody listening to this who's been a part of recovery knows, it's all about giving, right? And helping other people. I mean, that's really the essence of a recovery program. And and so I started doing that. And it dawned on me at some point, a couple of years into that process that I could do that professionally for a career. And it was like a, mind-blowing cathartic experience that I realized like, oh wow, all the people that helped me when I went through treatment, I could be one of them, right? And so I went about kind of starting to do that. I went through a counselor training program. I feel like I got a little fortunate, kind of timing wise, if you will, because I was able to go through kind of a almost like a technical school or a vocational school program for counseling. And now to get the type of license that I have, you need a master's degree, right, in addictions counseling. So at the time, you did not. So
Right.
I was kind of fortunate in that realm, but it has kind of worked out for me, and so I was able to complete that program in a couple of months. But the reality is, so much of what I've done from a practicing standpoint, from like a clinician standpoint, has been based on my personal experience and then what I've learned from peers in the field. Right, I've been able to interact with so many wonderful therapists and clinicians and psychologists and all that stuff over the years and learned so much from them, way more than anything I ever learned in a textbook, to be honest. And so anyway, so started to put that into practice, and as you alluded to earlier, I worked for a couple of programs really specializing in the adolescent and young adult population because that was you know where I was at in
Your
my
first
life
experience.
when
Right.
I went into recovery and went into treatment, and then eventually started expanding into a private practice realm where I worked with really all ages, and from there started to not that I knew we would call it Midwest recovery centers, or I didn't even necessarily know at the time who I would partner with, at what it looked like, but started to kind of put together some thoughts around opening my own treatment center.
Yeah, no, I'm trying to kind of put myself back in that time, and when you got into recovery, which at a quite a young age, I like to add, that's pretty rare. A lot of people might have little ones or children or whatever who are starting to get into some trouble, and that's kind of a scary time because you think, well, they're not most 16, 17, 18-year-olds are not making great decisions, right? Their brain hasn't fully developed. They're not totally matured. Their emotional intelligence isn't all the way there. And so, I think I've noticed parents at times questioning if, is this a full-blown issue? Should we put them into a program, or do they need to be around the right crowd? And it sounds like you kind of got the best of both worlds, right? You got a new social setting that was also versed in how to deal with substance abuse. And I happen to know the program that you're talking about, Crossroads, right? Great program. And I was actually somebody that was in that program as well. And I think it's also important to note, you're being very humble right now, but you actually helped come out and form the Kansas City branch. You kind of helped with developing some of that, right? For
Yeah,
Crossroads?
I did. That was in, God, I want to say around 2004, if memory serves.
Hmm.
Where I came out to Kansas City initially and worked for Crossroads at the time, like you mentioned, and kind of helped them find their location. Actually, here in Martin City, and they're still different building now, but they're actually still in this area. So yeah, pretty proud of that, and excited that I was able to be a part of something like that. Back that still continues on now. We're a couple of decades later, and although I haven't worked for that program or with those guys since I want to say '09 or so, um, it's still something that I'm proud of, and something that was a part of my experience and journey. And I think you brought up a really great point, which I get this question a lot, which is, yeah, how do you tell if a young person, if they're in full blown addiction, if they're in abuse, if it's just kind of quote unquote normal, what is it, just experimentation? Like what are they going through? And like so many other things in just the human realm, forget this specific topic, but just for us as people, I don't know if there's one pat answer to that, to be honest. Yeah, I don't know if there's like a criteria. There's plenty you could find if you looked it up. That doesn't necessarily mean that it's accurate for every person, right? All I know is, for me, I feel like the steps that my family took during that time period of struggle for me were the right steps. Like I don't think they overreacted. I think they did exactly what I needed, and they set up some tough boundaries. They got me some good professional help, and that was able to kind of catapult me into a new life, if you will. So, again, I get it's a tough question, and it's tough for every family, and you really got to do some soul searching and sit with some good professionals and kind of figure out what's the best path for your particular family to take based on what your values might be, and then based on what the facts are. I guess that would be my biggest piece of advice, or however you want to put it, would be don't be oblivious to the facts, right? Like, don't turn your head away from the problem. If there is a problem there, dive into it and really examine it for what it is, and then take whatever steps you feel are necessary. So anyway, I just kind of wanted to throw that in there.
Yeah, those are some really good, important notes that you mentioned in terms of your experience there, and what should a family do. I think when somebody comes into contact with a loved one, right, that is doing something inappropriate, right? That you typically wouldn't tolerate if they weren't your child or your loved one, right? It can put us in a little bit of an uncomfortable and awkward position emotionally. And I think, at least for myself, and our approach tends to come with our own stuff, whether we're projecting fear, anxiety, and not knowing how exactly to handle it. And so it can be easy for folks to maybe overreact or underreact, right? Like, well, no, let's not even talk about that. Little Timmy is not, we're not gonna, he's not doing that. Everything's fine. We're not gonna go there. And I've seen families that are scared and don't maybe realize how much they're doing that, but maybe avoiding the situation entirely. And then I had, my dad set some very firm boundaries big time, right? And there were moments when I acted out and perhaps he overreacted in his um, approach to disciplining me. So I really appreciate that you brought that point up, right? That, addressing it assertively and directly, right? And try to set aside your own emotions so that you can make the best informed decision for your loved one moving forward. So, that I think a lot of families will appreciate hearing that from you. And shout out, by the way, to Crossroads. It's a phenomenal program for young people. We work with them occasionally when they have individuals that need, more of a medical treatment at times, but for a really young population, Crossroads and Full Circle have helped a tremendous amount of individuals who otherwise felt lost and needed to learn how to find a way to live again in an enthusiastic manner, which kind of leads me to the next topic. I know that Kevin, one of our other founders and owners, was also a part of Crossroads. He went through it himself. He worked for them as well, got some training with them, did some great things. And I'm curious, with you two starting Midwest Recovery Centers, how much of what you learned perhaps in Crossroads, and again, I know you worked for other treatment centers since then, right? Before MRC, but what were there some of the pieces, right? Like there's a very big sense of love and connection and being there for one another and that sense of community that really embodies Crossroads. How much was MRC influenced by that? Because we had the housing with PHP model for a while, which seemed like it really fostered a similar sense of community. Do you think some of that went with you guys as you were formulating MRC in the early days?
Yeah, I think so. I think to a greater extent that speaks to really what we learned in the recovery community, because so much of recovery is about, fellowship and bonding and having peers and having connections and things of that nature, that it's almost impossible to achieve the goals that we're trying to achieve with people in treatment without that, connectivity piece, right? They say that the opposite of, addiction is connection, right? And I think that's really been at the heart of what founded our philosophy in terms of this program. The thing that I can specifically say that I took from my experience, whether it be in Crossroads or any other enthusiastic recovery program that I was associated with, was the enthusiasm part. Right, I think for a long period of time, and I think this is changing just kind of nationwide or maybe even internationally, just from a stigma perspective, but, I think the perspective that people had on recovery, sobriety, treatment, working on yourself, whatever you wanna call it, was almost like some sort of prison sentence, right? It was almost like a kind of a drab or, "Oh, man, I'm so sorry you gotta go to treatment." Or, "Oh god, you gotta work on yourself. Oh,
Right,
dude,
right.
let's
Or,
try
oh
that."
gosh, you're in therapy. What's wrong?
Yeah, yeah, correct. "What's wrong with you?" Or whatever these things may be, and that's not the, system I grew up in, for lack of a better way to put it, if there is a better way to put it. The system I came up in through treatment and through a recovery process was, "Hey, this needs to be fun and exciting, and if you're just gonna sit around all day," especially with younger people, right? If the reward for working on yourself was you just kind of sit around and, you know, I don't know, play checkers with your parents every night, that's not exactly going to land. You know what I'm
Right.
saying?
Yeah.
And that there has to be an enthusiasm and, hey, let's do this. This is going to get, everybody's lives better and allow you to have a much higher, ceiling for how your life can end up than what it was when you were kind of in the trenches, if you will. And so I think that perspective really helped both Kevin and myself found the backbone of MRC and to do it from coming from a place of, hey, let's make this fun. Let's make this, let's be excited about this. It helps both the staff and the patients and us on a, Kevin and I, one of the things that we did when we were starting this was we kind of went through, because we had a lot of experience working for a lot of different programs, right? And, no place is perfect, not even us. And so we had a lot of, all right, let's go back and see what did we not like about, places we've worked? What do we not like about our own treatment experience? And again, it's not to knock anybody or any play. It's just to say, like, all right, if we had a clean slate, which we kind of did, we didn't have anybody else telling us what to do or what to, how to build the program or whatever, how would we build it, in the way that we would have wanted to go through it, or in a way that where we would have wanted to work for us, or, that type of thinking. And so we pulled from a lot of experiences, positive and negative. Now, almost like anything else in life, and so, I'm sure we've made plenty of our own mistakes, and if you or anybody else that worked here or had been a patient here was today going to go out and start their own program, I'm sure they would, have a lot of things that they really liked about what we did, and I'm sure they'd have a few things that, like, "Oh, I'm not gonna do that," or "I'm gonna do that different," and that's great. I mean, that's part of how we grow and, evolve as people, and as, it's almost like parenting in a sense, right? Like, you kinda try to, or at least in my experience, you kinda try to not make the same mistakes that your parents may have made, then you end up making some of your own mistakes that your kids are like, "Well, I'm not gonna do that." And that's just kinda how it goes, but ultimately you end up taking more of the good, and I feel like that's what we were able to do.
So yeah, speaking to a lot of the things that you learned and what you wanted to bring to MRC and maybe leave behind, I think what stands out to me the most, this was just on the top of my mind as you were speaking, is the fact that you guys have never kicked somebody out of treatment once insurance started paying at a different level of care, right? Which unfortunately we live in a world that's very much driven by not so much the health care that somebody needs but rather by what insurance is going to pay for, regardless if that patient had been paying their premiums and paid their deductible, right? It can shift around and it can be a pretty tumultuous environment in which to kind of wrestle with the insurance companies in a sense. And I remember since the day I came here, I never saw that. I never had anybody say, oh, my insurance is paying for outpatient now, so I have to leave. And I remember when I first went to treatment, I went to La Hacienda in Kerrville, Texas, and it was a great experience. But I do remember hearing some individuals that would say, "Oh, I got to go. Insurance is up." And I'd think to myself, "What do you mean insurance is up? What do you mean? Like you're not done with the program? I thought it was a 30-day program or even longer." And well, my insurance stopped paying. They met with me, and I was like, "Man, that doesn't seem right. We're so vulnerable, and we finally have a little bit of a sense of what we're going to do moving forward. And it's been so difficult to get to this moment. And now it's just kind of being pulled away from like an administrative standpoint of somebody who doesn't even see you and the progress and work you're doing here. And that this could potentially not just change your life, but everybody you come in contact with, your family, right? Your loved ones, your friends. So I really appreciate that you all have always been very generous, maybe even too generous at times, if we're being honest, but being very generous, right, with the clients that come through this treatment program and really making it about them, right, and their experience and their ability to have a successful experience, right? I mean, more times than I can count since I've worked here, we've done the right thing in a lot of different situations where we took the hit from a financial perspective. And obviously, we have to be, responsible to make sure we stay open. But I've seen many moments where the priority was we wanted to start a company where we were going to change lives and we want to stay committed to that mission and make sure that we can do whatever we can to ensure that that's going to happen for each person in our care. So I noticed that.
Yeah, no, for sure, and to us, it was a little bit of a head scratcher that we were, I'm not gonna say the only, I certainly don't know every program out there, not even, whatever percentage of programs out there, but certainly the only one that we know about that saw it the way we did, which was, you know what? Let's just shoot straight with people from the beginning. We're going to tell them, yeah, this is what your insurance is going to pay. Here's what you owe us from a deductible or whatever the case may be perspective. Once you pay that, you're good. We will, I hate to use this term, but it's the truth. We will battle the insurance company to get paid, and if they decide to stop paying us, if we told you you're coming in for 30 days and they'll only pay us for 20, well, that's not your fault, right? And we either should have told you from the gate, you're probably, or you could only end up staying here 20 days, but we don't tell people that. We tell them it's 30 days or it's 45 days in the mental health program or whatever the case may be. And so we honor that. And to us, that does not seem to be this like unbelievable, oh my God, these people are so wonderful because they just do what they say they were going to do. But to your point, unfortunately, a lot of places seem to not do that. And that was one of the things that Kevin and I and Jeff Howard, our original now retired partner, that was one of the things that we took really seriously in terms of we're not doing that. We're not gonna dangle the 30-day carrot in front of people's faces, or really in front of their loved ones' faces most of the
Hmm.
time. And they entrust us with that family member or themselves or whatever the case may be. And 2 or 3 weeks into it, we kinda pull a bait and switch and say, "Oh, I'm so sorry, your insurance won't pay anymore, so you either gotta leave today or cut us a check for the remaining however many weeks," and that can get pretty pricey, and,
Hmm.
that's just not fair to do to people. I'm not even exactly sure why that's legal or if it's legal, but I know plenty of places do it,
Oh
and,
yeah.
maybe somebody will challenge that one of these days, but we don't do it like that. It's there's plenty our perspective again, and maybe it's a little, cosmic foo-foo or whatever you wanna call it, but that's fine. But our perspective has always been, like, if our intention is to help people and we keep that the goal first, then the financial side will take care of itself. And, we've been fine. The business side of things has been good. I guess we could have pocketed a few more dollars along the way, but that's not why we
Right.
got into this, and that's not why
Hmm.
anybody that works here got into this. And that just never seemed to us to be a fair way to do it, and especially to put it on your therapists and your clinical team to go tell their patients, hey, you got to go if you can't pay today or whatever the case may be. We didn't want our therapist to ever have to be in a conversation like that. I'm not even sure if they know what it costs to come here if a family does private pay. They
Right.
certainly don't know the ins and outs of the insurance side because we don't want them to have to worry about that. They can just care for the people sitting in front of them that day, and we'll deal with all the rest of that stuff. So, yeah, it's been a pretty effective model, but really our biggest thought on that is, kind of surprised that a lot of other places don't do it that way.
Hmm.
Uh, but that's the way we're always going to do it. So I feel really good about that.
I do too, that I get to be a part of it. It's very commendable. And I think also this is with intention, right? Like we had all levels of care in substance use disorder with the idea that if insurance was going to bully us, which is kind of what they're doing, right? They're being reductive in how that patient ought to be treated, but it is what it is.
Right.
They're quite literally like reducing the level of care they'll pay for, but we have all the levels of care. We have housing, we have structured step down transitional program for a year. So if they were to do that, it's gonna be a much, much different rate that they're covering, but we still want that patient to finish out what we said they were gonna start, right? And I think that's just the best part of it, you know?
Yeah, the patient will finish out what we agreed to and what we told them on that initial phone call. I don't care what the insurance pay. If we take somebody into our care, they're staying for the length of time we told them, not somebody in, Schenectady, New York somewhere, being paid by the insurance company to really base everything on exact medical criteria, which I understand, and I think sometimes that gets a bad rap. I mean, I think for years, people in the recovery community wanted the mainstream community to take us, if you will, seriously when we said this was a disease. And then ASAM, American Society of Addiction Medication, got really on board, and doctors and hospitals and insurance companies got really on board. So now it's everybody knows it's a disease, right? Well, it's you can't have it both ways, right? If you're gonna push for it to be considered a disease, then the medical community is gonna base everything they do on basic medical standards, Which, yes, is that the same thing as sitting in front of a patient and getting to know them and know their family and know their situation? Of course not. But that's not really how the medical world works, right? They work based on science.
Measurable outcomes. They wanna measure, yeah.
If the science says this person needs to be in detox for 5 days and then residential for 10 days and then they're good, then, that's what it's gonna say, and most clinicians, most therapists that I know will disagree with that assessment, but we understand, well, when you invited the medical world into your sandbox, if you will, then they're gonna take it over and they're gonna play it by their rules, so you can either adjust and find some harmony in how you do things, or you can throw a fit and they're not gonna pay you anyway.
Right.
So, we decided to adjust and find some harmony in being able to help people.
Yeah, absolutely. And, I mean, you're right. I think that if we're being honest, unfortunately, this disease is extremely difficult to recover from. If you're dealing with full-fledged addiction, it's very, very difficult to recover from. And not only that, but to stay in long-term recovery, the odds are extremely low, right? And again, I don't want to be too dark here with what we're talking about, but that is the truth. And if I were to kind of give an estimate here, I'd say a lot of people sometimes don't even do well just after doing a 30-day inpatient program, right? Like they really need something else after that. If they need maybe outpatient aftercare, right? Or really a firm resolution that they're going to commit to like some type of support group or seeing an individual therapist or something that's going to help them to maintain that sense of community and accountability that they were establishing when they were here, right? And I think most people, even listening or watching right now, can, if they're being honest with themselves, I mean, it takes a while to build a habit and a new way to live, right? And somebody with a substance use disorder or mental health, if we're talking about it took perhaps years or their entire life to get to a point where it was dysfunctional and they had self-defeating patterns of behavior, negative maladaptive coping tools that were really harming their relationships and them and their ability to work and provide and be in the world, that's not gonna change in 2 weeks. I mean, thinking that will change in 2 weeks is laughable, you know, and in a month even is that's a tall order. That's a very tall order, you know, it's gonna take and that's why I think from the beginning, Kevin always speaks to the goal, right? And I think you, work with the clinical team a lot and kind of tell them, you know, we want 90 days, and maybe that won't be our phase 1, like all inpatient. Maybe it will be inpatient and then do IOP for a couple months, right? But the idea is to try to have some type of clinical structured setting in which they can really work with some professionals for a few months. And that's really what we see as a defining uh, time frame of what it takes for individuals to really grab a hold of some of these new ways of living and kind of have a new design for how they live.
Yeah, you said it. I mean, I think it's pretty common knowledge now in our field or a common thought or understanding that just doing a 30-day program, while better than nothing, and I want to be clear here, I understand that people, obviously have lives and they have factors in those lives. There might be kids involved. There might be, work scenarios involved, although generally not as much as people tend to think. A lot of times your employer, yeah, they want you healthy and better. And if that takes 90 days or 6 months, or obviously it was certain parameters around that, but they want you to get better, right? Obviously your family wants to get better. But, obviously there's people that can't go all in and do 30 days of inpatient and then, 60 days at house sober living and then another 60 days somewhere else or whatever the case may be. And we understand all that. But facts are facts. And the facts remain that early recovery is about a 2-year process, right? So that means for you to be firing on all 8 cylinders in all the areas in your life that you need to be firing on all 8 cylinders, it takes about 2 years. Now, that doesn't mean you don't get better for 2 years or nobody would ever do anything about it. That doesn't mean you're not seeing constant results, right, over that 2-year time period. What it means is you should stay in touch with professional support for those first 2 years. Now, The back half of that year or year and a half or whatever it might be, like you said, could be an individual therapist you check in with once a month. It doesn't, I'm not saying everybody needs to go through, an every day for 2 years or even a year or 90 days or whatever program. What I'm saying is, you get a lot thrown at you in a 30-day treatment stay. It's a little bit like a shotgun approach, right?
Mhm. Mhm.
And for those who aren't super familiar with shotguns, basically you're firing a shell and a bunch of pellets go out of it, right? And then kind of scatter everywhere. And you're hoping a few of them, hit your target, right? But not all of those pellets are going to hit the target. Your first 30 days of treatment is kind of like that. If so much is being thrown at you, some of it's going to stick. There's no way all of it is, right? And so what sticking with the program or getting involved in some professional services aftercare wise does is it helps kind of collect all those pellets, if you will, from my analogy, and make them make sense and make them applicable to your life as you're re-entering your life, right? Because what we see a lot, and this is I guess sad but unavoidable to a certain extent, for people who aren't willing to do something. And you said it doesn't have to be our program, doesn't have to be with anything we recommend or whatever. It's just you want to do something after that initial 30 days. But what we see a lot is people do really well during that first 30 days, and they kinda have a, "Hey, thanks, got it from here," and then they backslide, and then some of the times aren't able to make it back or make it to another treatment center or make it to a recovery meeting or whatever the case may be, because they don't take those next steps, and they don't really buy into, regardless of how much we or anybody tells them, that this is a journey and it's a process. Right? And those first couple of years are really the key to everything, you know? Uh,
Mhm.
you go get
Yeah.
yourself 5 or, 10 years clean down the line and you wanna reevaluate your choices in your life and, great. You got years worth of a fully functioning brain and evidence and all that. You can kinda figure that out then. But those first couple of years, you really want to stay in touch with professional services, a support system, and avoid, really any drugs or alcohol.
Mhm. Yeah, absolutely. I was thinking about, when I was speaking with the admissions team and training them how to talk to families when it comes to I think it's when when we had opened the mental health inpatient program, right? Where there's everything you're bringing up is so spot on. What I was telling families for a long time was that in the substance use disorder realm, right? People struggling with addiction, which is obviously a fatal disease, right? A chronic relapsing disease. And it's a little safer to tend to, if you're going to pick the wrong level of care to go into, it's probably smarter to go up. That's what I would usually tell people. Like, would you rather be looking back from now thinking, "Oh, man, we really should have put so and so in inpatient versus outpatient. Now they're gone and they're off with their running buddy and only God knows where they are and if they're even alive." Or would you rather know that they're in there, set some firm boundaries, deal with the backlash and recourse, and continue to work forward with your own recovery and showing your loved one the boundaries you're gonna have moving forward and that they're responsible for their recovery? And things got a little bit more complicated once we opened the mental health inpatient because you're dealing with sometimes they have substance abuse issues happening co-occurring, but sometimes when it is just mental health, it can be a little bit of a different approach, right? It's not necessarily by their own actions that they're having ailments and they're having struggles and they're having discomfort. It's some of their brain chemistry might be firing in a way that's not conducive to them living life, right? They could have a mood disorder, they could have a personality disorder, or trauma, which can we know now can morph us in ways that is really painful and confusing, right? And you want to show empathy and have a little bit of a softer touch when you're talking about helping those individuals, but at the same time, right, there's still a very real potential harm that could come if they don't get the help that they need, right? And so again, I try to tell the team and to tell families Again, the worst thing that'll happen if you go to an inpatient is you do well, you do really well, and your life gets a lot better. Or maybe you decide that it was too much structure. But the harm that could come from picking outpatient when you really needed more could be much greater. It could be much, much greater. What are your thoughts on that?
Yeah, no, I agree with you. I think that I always tell people, look, it's certainly an art, not a science, even though there's some scientific components to it and evidence-based treatment like we talked about earlier. But as far as, what level of care somebody should be in or how long they should be in that particular level of care and all of that stuff, it's really hard to nail it exactly. And so if you're gonna miss, you better miss on the side of too much versus too little. If you couldn't be perfectly content with the meal, would you rather be starving or too full? Right? Well, you'd rather
Totally
be too
agree.
full. I mean, 100%. You'd rather be too full.
Yeah.
And I kinda look at it the same way with this sort of thing. So I agree with you. I think people like to look for a quick fix. I don't think this is a quick fix type of an issue. I mean, we've
Right.
never seen evidence that there is any sort of quick fix. Even some of the medications, because people will say, well, what about, anti-craving meds and even all the way back to Antabuse, which has been around, 100 years or whatever the math
Mhm.
is.
Mhm.
And any versed doctor, right? Any doctor with real experience and any sense about them will be the first to tell you, I can prescribe anybody all those medications and they can be effective. They're only really effective if the other components are being addressed, right? Meaning, I can deal with the physical side of things, but if somebody's not dealing with the mental side, and if somebody's not addressing the emotional side, and if somebody's not, working on the spiritual side, whatever that means to every, individual or family out there, then you're really only addressing a small percentage of the problem, right? And, you only address a small percentage of any problem, the chances of that problem coming back are almost 100%, right? Of that problem coming back at some point. It would be akin to if you found, a bunch of ants in your house and you said, you know what, I'm going to get rid of 10 of them, like 10 individual ants, and then the rest of them will just go away. It's like, that's not really how that works, right?
That's
The
not how
rest
that maths out.
and come back, and it's just you gotta do the whole you gotta get the spray, you gotta remove all the food from the basement or wherever the case may be, and you really gotta take some steps to address the problem, and that might take some time, and it might take some money, and it might disrupt your life a little bit, but these are all things that I could tell you what'll take more time, more money, and be way more disruptive is a undealt with or unaddressed drug, alcohol, or mental health problem, right?
Yes.
And those things will not get better on their own, almost never, right? I don't want to say like never, never in the history of the world because, as they say in Star Wars, only the Sith speak in absolutes, right? But almost always, this I can promise you, if those things are unaddressed or unattended, it's just going to create more destructive issues down the road, So,
Absolutely.
yeah, I agree with you.
Couldn't agree more. Gosh, we're coming down towards the end of our time. I wanted to go over some interesting numbers and metrics with you and just kind of get your reaction. But I feel like we could talk for hours. We could do so many episodes talking about, what you all were thinking when you first started MRC. But again, I just want to say thank you. And I think the over 100 people that are employed and others who are with us for just a season would all be grateful to you and Kevin and Jeff for forming this incredible company that oftentimes is described as a family more than an actual company. So I think that's credit to you and Kevin and Geffen and your heart and energy to know that the place that you formed as an employer is known more as a family, right? Just to kind of give people a cumulative review, it started as a PHP, which is outpatient, right? With housing for men. It grew to have an outpatient in the evening program. It grew to have a women's program with housing and outpatient. It grew to get a medical director and started detox residential. And then we grew to have a mental health inpatient program. And we just recently grew to have a mental health IOP evening program. And not only that, but we have positioned the ability for more of our patients in our care to be able to participate in TMS, which was once just in our mental health inpatient program. So, time and time again, you and Kevin have continued to take actions that are all centered around our patients and what their needs are. And the LAI, the long acting injectable clinic, which is absolutely huge for mental health patients to not have to take, a pill every single day, but to do a monthly injection. All of these things, ever since we went down the mental health route, it's just we've grown and grown and grown. How does that make you feel to know that you have just countless times responded to the needs of the patients?
Well, I don't know if we've spent a whole lot of time reflecting on it because we're in it every day. That's almost one of those things where if you look back, maybe one day when we're retired or whatever the case may be, and you kind of look back on it, then I think maybe the gravity could hit us a little bit more. But for now, we're just doing what we've always done, which is, reminds me of we're coming up on holiday season, right? It reminds me of the movie Christmas Vacation
Hmm.
when Chevy Chase is kind of losing it a little bit. That's not the analogy, don't worry, but, and he takes a chainsaw and he saws off, like, a loose part of the newel post,
Yeah.
and he says, "Honey, fix the newel post," and she kinda confronts him, and he says, "Well, I simply saw a problem and I fixed it," right?
Hmm. Hmm.
That's the point that I'm making. We simply just saw needs in the community
Hmm.
and adjusted to those needs, whatever those may have been. Like, and this kind of goes back to something we were talking about earlier. When we came out here, we didn't necessarily envision a detox center and a residential center and a mental health center. And like you said, it was basically just a housed PHP program for men. And I think if you would have asked us in 2016, "Hey, if this thing gets full with 10 people in it and, you're doing well and they're doing well, and are you happy with that?" I think we would have said, "Yeah, that was the vision at the time." But what we've been pretty good at is just, adjusting to needs that we see in our community in this arena. And so when the need to get some more houses it became clear that we needed to do that, that's what we did. When it became clear that we needed to start a women's program, that's what we did, right? When it became clear that we needed to build a detox and a residential center, that's what we did. Then a mental health, then, mental health outpatient, that, and this, that, and the other. And I think we're gonna continue to do that. And but that's all we've done is we just respond to what we see that the community needs in our arena. And it's been a pretty fun ride to this point, that's for sure.
Absolutely. Okay, one last piece. So I'm going to give you a number and you have to guess what I'm referring to.
Okay.
Okay. All right. And this number is actively changing, obviously. 2,175.
2,175. Is that the amount of people that have come through MRC since
Yes.
we opened?
Yeah.
Wow, that's awesome.
I figured you
That's a
would
good
like
number.
that. So, and of course, that
Yeah.
number's growing, unfortunately and fortunately, each
Yeah,
moment,
right.
each day. But over 2,000 lives that your dream has helped change their
Wow, I
lives.
did not know that. That's
Yeah.
awesome. Yeah, that's
Yeah.
cool.
So, yeah,
It's a big
thank you so much for your time, Geffen, and to all of our viewers. Thank you for listening and for supporting us. And we thank you for your time and energy today, Geffen. I know that you have a lot on your plate, a lot of departments that you're overseeing and helping to orchestrate and make sure that, our patients and clients, as we call them here, are staying number one and we're doing the best thing for them. So thanks for taking the time out of your day to come chat with us. And yeah, we'll look forward to having you on again sometime soon.
Anytime, my friend. Thank you.
Alrighty. Well, thank you very much to Geffen Lieberman, one of our founders and the VP of Operations here at Midwest Recovery Centers, for taking time out of his day to share a little bit of insight about some of the heart and energy and vision that went into starting Midwest Recovery Centers. We know that he is very busy and overseeing a lot of departments to make sure that patients are getting the care that they need. So, thank you very much to Geffen for sharing some time with us today and a little bit more about what made Midwest Recovery Centers a reality. As always, if you or a loved one are struggling with mental health issues or substance use disorder issues, please know that you can reach out to our admissions team 24/7 at 816 597 1177. Thank you so much for listening, and we hope you have a great day, and we'll see you next time on Finding Mental Wellness.